Good evening. My name is Jack Sterling, and this is my patient Park. I am here to perform a physical assessment on him. He came into my office today. We started with a full set of vital signs. His temperature was 98.2, his pulse was 88, his blood pressure was 118/68, his respiratory rate was 14, and his oxygen sats were 99% on room air. We also did a height and a weight. His height was 6 feet and his weight was 175. So beginning my assessment, I've spoken to him a little bit. Do you know why you're here, what we're doing today?
Just getting a checkup.
Yep. Do you often have checkups?
Once a year.
That's good. That's good. Do you consider yourself to be in good shape?
I do.
Good health?
Mm-hmm.
Good. So that begins my neurologic assessment of him. I see he's properly groomed, he's got a good affect, he's in an appropriate mood, he's answering my questions appropriately, he knows where he is, why he's here, and I can also do a little bit of a neurologic exam, looking at his pupils. They're equal and reactive to light. Moving on to integumentary, I'm going to start by looking at his hands. The skin color looks good. I see no abnormalities. His nails are properly groomed and there are no issues with any nails. And as I continue on through each part, I will look at the skin for that part as well. I'm going to start up here by looking at his hair and his head. Everything is symmetrical. I don't feel any lumps or bumps. I already checked his pupils. I'm going to look at his eyes, look closely with my light. I see the sclera, the conjunctiva, the iris. Everything is symmetrical. Moving down to his nose, actually, he does have a little bit of his nose is a little bit crooked. Have you had some kind of injury to your nose?
Yeah, I got hit with a baseball.
Okay, so I can actually see that in my assessment. If you'll go ahead and look up for me, looking in here, his nares are patent. I see no drainage.
I have congestion problems.
You do. There's a lot going around right now. Moving down to his mouth. Can you say ah? I see his tonsil. Say it again. See the uvula move when he says ah. Again, his mouth, everything looks symmetrical. Tongue looks normal. No issues there. I am going to put this away. I'm going to feel his neck. I feel no lumps, I feel no swelling. And I'm going to conclude this piece with his ears, and I'm going to pretend to use my otoscope. I am going to pull up and back. Any pain there?
Nope.
And looking in his ears, I can see the inner ear, outer ear. I see no drainage, no redness. Everything looks good there. All right, moving on to the respiratory and thorax system. I'm going to start by having you kind of scoot up a little bit if you can and scoot that way. Good. Pull up this shirt. Go ahead and take a deep breath for me. Good. I feel symmetrical chest rise from back here. I'm going to listen to breath sounds. If you'll take a deep breath. Good. And another one. One more time. Good. I'm going to go to the front and do the same thing. Deep breath. Good, so lung sounds are clear. I hear no wheezing, I hear no crackles. His work of breathing is easy. I'm gonna one more time place my hands right here. Go ahead and take a deep breath. And again, I feel a symmetrical chest rise. Good. All right, I'm gonna go ahead and have you lay down now, if you will. Perfect. Moving on to the cardiovascular system, I'm going to start by just listening to your heart. Listen up here to the carotid. All right, and one more time, let me have you sit up. Lean forward a little bit. And good. I hear no murmurs. I hear S1, S2. Heart sounds are normal. There's no abnormal rhythm or rate. Moving on to the abdominal assessment. I'm sorry, I'm going to have you lay down one more time. I am going to listen to his abdomen first. Listening in all 4 quadrants. I hear bowel sounds in all 4 quadrants. I'm going to palpate his abdomen. Do you have any pain or tenderness?
Mm-mm.
Palpating his liver and spleen. Doing some light palpation and some deep palpation. Good. Moving on to the genitourinary system and the reproductive system. For the sake of this environment, we're not going to thoroughly examine all of those, but are you getting your checkups yearly?
I am.
Doing testicular exams?
Yes.
Okay, and any issues with urination, difficulty urinating, increased frequency?
No.
No problems with that. Okay. All right, great. While you're laying down, we'll move on to the peripheral vascular system. I'm going to feel for radial pulses. Those are equal. Strong pulses. I'm going to check a cap refill. About 2 seconds. Both hands are the same color, the same temperature. I'm going to go down and do the same with his feet. Check for pedal pulses. Get you to wiggle those toes. Good. And both of his feet are the same color, the same temperature. The temperature feels the same in both of his legs. I don't see any kind of edema anywhere. Moving on to the musculoskeletal system. I'm going to go ahead and have you stand up for me, Mr. Sterling. There's that congestion you were talking about.
Mm-hmm.
If you could just move your arms side to side, up and down. Yeah. And do the same thing with both legs. Do you have any pain anywhere?
Mm-mm.
No issues. Can you walk back and forth across the room? Good. Good, and maybe sit down for me one more time. Let me just check this temporal. Go ahead and open your mouth. And close it. Good. One more time. Arms above your head. Good. Alrighty, I think that concludes our assessment. Any questions for me?
Nope.
Alrighty. Thank you for your time.